In the quiet hours of the night, while many are lost in peaceful dreams, there's a significant number of people struggling with a condition that disrupts this serenity: sleep apnea. This condition is more than just a minor inconvenience, it's a silent adversary that can have profound effects on one's health and quality of life. Today, we're diving deep into understanding sleep apnea and exploring the various methods to overcome it. Sleep apnea is a sleep disorder where breathing repeatedly stops and starts. If you snore loudly and feel tired even after a full night's sleep, you might have sleep apnea. The main types of sleep apnea are: 1. Obstructive sleep apnea, OSA, the more common form, it occurs when throat muscles relax. 2. Central sleep apnea, this occurs when your brain doesn't send proper signals to the muscles that control breathing. 3. Complex sleep apnea syndrome, also known as treatment-emergent central sleep apnea, this type occurs when someone has both obstructive and central sleep apnea. The symptoms of sleep apnea can be somewhat elusive because, well, you're asleep when they manifest. However, a partner or family member might notice signs such as snoring loudly, gasping for air during sleep, waking up with a dry mouth, morning headache, difficulty staying asleep, excessive daytime sleepiness, difficulty paying attention, and irritability. But why is it essential to address sleep apnea? Beyond the immediate symptoms, untreated sleep apnea can lead to a variety of complications, including cardiovascular problems, eye disorders, type 2 diabetes, metabolic syndrome, liver problems, and complications with medications and surgery. Now, let's delve into the solutions. Lifestyle changes. For milder cases of sleep apnea, lifestyle changes might be all that's needed. These include: lose weight, even a slight loss in weight can relieve constriction of your throat. In some cases, normalizing your weight can completely cure you of the disorder. Exercise, regular exercise can help ease the symptoms of obstructive sleep apnea even without weight loss. Try to get 30 minutes of moderate activity, such as a brisk walk, most days of the week. Avoid alcohol and sedatives, these relax the muscles in the back of your throat, worsening obstructive sleep apnea. Sleep on your side, sleeping on your back can cause your tongue and soft palate to rest against the back of your throat and block your airway. Therapies. Continuous positive airway pressure, CPAP, a machine delivers air pressure through a mask while you sleep. The pressure is somewhat greater than that of the surrounding air, which is just enough to keep your upper airway passages open. Expiratory positive airway pressure, EPAP, these are small devices that you place over each nostril before going to sleep. They allow air to enter freely but ensure that air exits through a narrow passage, increasing airway pressure and preventing airway collapse. Adaptive servo ventilation, ASV, this more modern airflow device learns your normal breathing pattern and stores the information. The machine uses pressure to regulate your breathing pattern, preventing pauses in your breathing. Devices. Mandibular repositioning device, this is a mouthpiece that repositions your lower jaw forward and down slightly to keep your airway open. Tongue retaining device, this is a splint that holds your tongue in place to keep your airway open. Surgery. Surgery is usually the last resort after other treatments have failed. Surgical options include: tissue removal. During this procedure, doctors remove tissue from the rear of your mouth and top of your throat. Your tonsils and adenoids usually get removed as well. Jaw repositioning. This surgery aims to enlarge the space behind the tongue and soft palate by moving the jaw forward. Implants. Plastic rods are surgically implanted into the soft palate. Creating a new air passageway, tracheostomy, this is a drastic measure, wherein a new passageway is created to aid breathing. In conclusion, sleep apnea is a condition that requires attention and care. If you or someone you know is experiencing symptoms, it's crucial to consult with a healthcare professional. With the right approach, it's entirely possible to overcome sleep apnea and enjoy restful nights once again. Remember, a good night's sleep is not just a luxury, it's a necessity for a healthy, fulfilling life.